The biggest puzzle pieces to the California budget is health care. Governor Newsom says he wants to cap enrollment of undocumented residents to Medi-Cal, the state's version of Medicaid. KTVU South Bay reporter Jesse Gary live for us in San Jose with reaction from people who say they'll likely be negatively affected. Jesse?
Claudine, good evening to you. And we're at Valley Medical Center here in San Jose. It's the largest trauma center in the South Bay. And as you can see behind me, they're building for their future, a future that could include seeing many more people using the ER as their primary place of medical care.
The more uninsured members of the community you have, the greater potential strain you have in the emergency department as patients present with routine care that otherwise could be cared for in the primary care setting.
That dire warning comes as California Governor Gavin Newsom proposes capping enrollment in Medi-Cal due to budgetary pressures.
It's a good idea, and I think it's necessary considering the budget problems that are faced in the state. Non-citizens shouldn't have access to Medicaid. It's too expensive. The outcomes aren't very good or worth it, and states and the federal government can ill afford it at this time.
Critics say the dollars and cents argument doesn't make sense. Preventing new undocumented adult migrants from accessing free health services starting in 2026 could make them more vulnerable to illness and more serious health issues. Children would still be allowed to enroll. Starting in 2027, undocumented adults already enrolled will pay a $100 a month premium. The governor's office estimates these changes will generate $5.4 billion in savings.
When we don't provide a healthcare safety net for the people who are part of our communities, that means there are going to be a lot of families who rely more on emergency services. And that is not helpful for any of us.
It affects their everyday well-being. It affects them out at work. It affects their families. It affects their longevity in their life. So this is a lifeline.
It's a lifeline for roughly 15 million Californians that advocates say could push any perceived budget savings into a red line as more treatments are put off until a trip to the ER is required.
When you add this additional strain to the system, it is going to ultimately affect flow through the emergency department as well.
There's strong support for Medi-Cal and for supporting all Californians in the Senate and the legislature, and I know the governor supports that as well. So we'll figure it out.
State Senator Scott Wiener saying keeping Medi-Cal solvent is key as they move forward with budget negotiations. They have to produce a balanced budget by the middle of next month. We're live in San Jose this evening. Jesse Gary, KTVU, Fox 2 News. Claudine, we'll head back up to you in Oakland.
Yeah.